Hello my friends, today I'm going to do a experiment for disc problem. So I treated many disc problem and they are very successful. So today I explain to you how do I do the tricks. Okay, so here I got a experiment. Is this red one represents the disc, and I use the magnifying glasses as a top disc, and also apply some pressure on it. And this handle is very important because I try to move the handle, and this called spinal process. So people, when they have my treatment, they knew I push this spinal process and mainly make the ligament on it loose, so then they can relax, not always tensioned. Okay, so let's do the experiment. So this represents the disc, and this part represents the herniated disc. So this is a air balloon. The air balloon represents the inside the disc, the power. Okay, so first I put the magnifying glass on the top. So this presents our top disc or body's weight. When the body's weight on it, normally it can take it and not cause herniated disc. But when we lift very heavy stuff and constantly lift, for example, if we lift a little bit of weight, okay, then you see the hernia disc, and then when you release the tension, it go back. Okay, normally it go back, right? Normally it can go back when you rest. But when the ligament tendon around the disc, especially the top, there's a process ligament. So the ligament on top of the spinal process, when this is too tight, for example, this is my weight, my right hand, my weight, and then when they apply the weight, you might use a process, press down, you see the disc herniated, and then they will affect the nerves on this area, okay, on this area, my index area, and then it will cause pain, shooting pain to your legs, and pain on your knee, pain on the hip, pain on the calf or your feet. Okay, so when this moment, if I relax my handle side a little bit, vertebral process. Okay, so that's my experience. Okay, so experience is to treat this to make the disc go back. Let's look at it again. Okay, so when the pressure comes, the disc herniated, and then the pressure reduced, it went back, and when they come back constantly, if we release this side, also the disc goes. From this picture we can see the vertebral process side, the space bigger, the disc healthier. So if like the low one, space very narrow, have a small space, and then the vertebral disc will prolapse, press on the nerves or spinal cord. Check the vertebral space and the pain level to diagnose where the herniated disc is. Also, the treatment based on the space of the vertebral process. So if the narrow one, then the disc herniated. So we push up the narrow one and move the vertebral, then the disc will regain the space and also will go back less or not press on the nerves or spinal cord. Okay, let's see a result of my treatment, how easily the disc go back and then not affect the a sciatic nerve anymore.
So-
Hello, Charles.
Hello.
Right, you are director of the company,
Yeah,
and you was recommended by somebody to come to treat your back.
I was, yeah.
Yeah, and you have a difficult move this morning, and you have sciatic pain, you
I
have
have
sharp
sciatic
and
pain,
even-
sharp pain.
Okay, right, you tell me the story now.
So you've just laid me on the bed and you've just been pushing
Move.
away and moving me around and manoeuvring me, and
Yeah.
now I can walk.
Yeah, and you can turn, you can move freely and move your back.
Yeah, this morning in the bathroom I was having to move around like this.
Yeah.
Now I can come in.
Okay, you are very happy with that, isn't it?
That's brilliant. It is amazing.
Thank you.
Amazing.
Thank you.